Okay, good morning, everyone. It is 9 a.m., Wednesday, November 25th, and I want to call the meeting of the Humboldt County Health Board to order. We will do a roll call first. Uh, Commissioner French.
I'm here.
And Commissioner Cherry.
Here.
Commissioner Bell.
He's having a little trouble getting on, he says.
We'll come back to him. Sheriff Allen.
I'm here.
Dr. Stringham.
I'm here too.
Commissioner Bell.
I think he's still trying. We've got a quorum, so let's go ahead, and I'm helping him on the side trying to figure it out. So.
All right, we do have a quorum, and we'll have Commissioner Bell on as he's able to. Would you all please join me for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. So we will go to public comment. You might have to help me throughout this, Dave, because I don't have my agenda up. But public comment is meant for the public to comment on any item that is not on this agenda. And if we have something that we need to comment further on, we'll need to have it put on an agenda for a future meeting. You have to *6 to unmute yourself. And so anybody that has public comment, now's the time, and please identify yourself for the public record. Public comment.
Join them.
Do we have public comment? Not hearing any public comment, we'll move to the next agenda item. And County Manager Mendiola, would you read that?
Yes, sir. Next item is update from Public Health Officer and Local Emergency Manager and Public Information Officer on county response to the COVID-19 coronavirus. For information only, a presentation by Dr. Charles Stringham, Public Health Officer, Captain Sean Wilkin, Humboldt County Sheriff's Office and Local Emergency Manager, and Nicole Maher, Public Information Officer, regarding the current status of the Humboldt County response to the COVID-19 virus, including but not limited to the latest number of positive cases in the county, as well as updates regarding other efforts to mitigate the spread of the virus. In addition, we will update the board regarding the dissemination of information to the public through various methods, information only.
Thank you. We'll go with Dr. Stringham first. Dr. Stringham.
Good morning, everybody. Is the sound quality okay?
Yes, it's fine.
Wonderful, thanks. So essentially, the challenges that we're facing with COVID-19 here in Humboldt County have really intensified quite a bit since we visited 2 weeks ago. And I want to bring each of you up to date on some of the issues, what we're facing, and some of the proposals that I have to be able to rectify some of these issues. To put this into perspective, when we visited 2 weeks ago, we had 31 cases in the 2 weeks prior to that meeting. And that number now stands at 102. And what that means is that we have really experienced a massive increase in the number of cases we've experienced, from 31 cases during 2 weeks to 102 cases during 2 weeks prior to today. That represents a very dramatic increase in the number of cases. And essentially what's happening is our medical infrastructure is starting to see some evidence of being overwhelmed. And hopefully what we can do is take the right actions in order to be able to curb this overwhelmed situation so that we're able to stay on a good track. Last night, I was notified by the Chief of Staff of Humboldt General Hospital about some very concerning details. The first is that the West Campus Clinic, which is our community's primary place to test, was overwhelmed enough that they were having to turn people away They weren't able to test all of the people who wanted to come for testing. That's really the first evidence that we've seen in the community that our medical infrastructure is becoming overwhelmed. It's critical that we take the steps now in order to rectify this before this really becomes a true emergency. Additionally, Humboldt General Hospital is currently at capacity, and our primary transfer facility, which is renowned in Reno, is also at absolute 100% capacity. They are not able to receive additional patients. We're having to become creative in order to be able to transfer patients to higher levels of care. And this also, to me, is evidence of a medical system that's seeing its initial stages of being overwhelmed. Can assure you that we're taking steps in order to be able to mitigate this. But my concern is that the medical system's ability to ramp up in order to meet these demands is never going to be as large as the community's capacity to continue to have viral syndromes. So we cannot keep up with the demand at this point. This is really becoming a very challenging situation for all of us here in the county. When this virus first became an issue here in Humboldt County, I had issued a challenge to the people of Humboldt County to please do the right things to make sure that we were going to be okay with this, and that if each of us did the right things, we could end this virus very quickly. And today, instead of giving you a challenge, I would like to issue a plea. And I am asking that every single person here in Humboldt County please do the right things so that we can preserve our medical infrastructure and our ability to deal both with COVID as a medical system and also with non-COVID issues. Because keep in mind that as the medical system becomes more overwhelmed, we lose the capacity or have compromised the capacity to be able to deal with other issues, myocardial infarctions, heart attacks, strokes, serious infections other than COVID. This is a very serious issue. The only way we're going to win this battle is if every single person does the right things. And it's more critical now than it ever has been. We're getting to a later hour in this crisis at this point. There's still too many people who are not doing these things. It's a very simple matter of distancing, of making sure that we see all other people as potentially being a source of the infection, and that we take the right measures to ensure that we will not get this virus. You know, a lot of people are not particularly afraid of this virus, and we're going to talk about that in a second. But maybe if you're not afraid of the virus, you could be afraid of what will happen to our medical infrastructure if more people don't do the right things. This genuinely is a threat, folks. I'm very concerned about this. I'm also concerned because we're already seeing a massive uptick, that by far the largest that we've seen throughout the entire pandemic. But the other issue is that soon Thanksgiving issues are going to kind of come to task with us. And tomorrow, Thanksgiving, I think that there are going to be quite a number of people who either visit the community or community members who go and visit other places. And my concern is that that brings a whole new group of individuals into proximity with our community members and potentially serves as a source of additional infections. We're going into the holiday season, the travel season, with infections that are already much larger than we have the capacity to deal with. And what's going to wind up happening is Thanksgiving is going to dramatically amplify that effect. And it's already not doing very well. So please, please do the right things, community members, so that we can see this through to a conclusion. I want to address the issue that we're hearing a fair amount these days, that the virus is nowhere near as lethal as it had been. And I want to address that, kind of explain that this is true. The virus started with a 6% lethality rate, meaning that approximately 6% of people who acquired this virus were expected to pass away. That was about what it was back in March, in the early months of this virus. That number now stands at 1%. So approximately 1% of people who are becoming infected with this virus are passing away. To me, that's still a very large number, but it also underestimates, and the reason is we've grown so quickly in terms of viral cases that the deaths that may result from those new cases have not yet occurred. Those patients haven't had the virus long enough in order to be sick enough to have major complications. And so the 1% may potentially be an understatement. This is the first issue. The second issue is that it's not just the risk of death that really concerns me. And some of the other issues that we see are chronic illnesses. Some of the patients go on to develop chronic respiratory compromise and various other things that happen that people can't do the same things after the virus. Now, most people, of course, recover uneventfully, but that's a chance I'm hoping that you won't take. It's critical. A lot of people wind up, when they get this virus, that respiratory capacity is not doesn't return to completely normal. And a lot of people are able to realize that, and in some cases are not able to do the things that they used to enjoy doing. The other issue is that it really is a game of Russian roulette, because while death rates are certainly higher in those who have chronic illnesses and an elderly, and I would make the argument that all of us, every single one of us counts. And just because somebody has underlying illnesses or is elderly doesn't mean that that life is any less valuable than anybody else's. It's critical that every one of us see this that way. It's important. Every single person's life matters. But the other issue that I'm equally concerned about is that we regularly have people who are young and healthy who pass away from this virus. So please don't fall into the trap that this is not dangerous unless a person has other issues, and if you are healthy, that you will do just fine. We don't know that. Plus, the other issue is that no matter how a person feels, no matter whether a person's afraid of this or not, and even if a person feels like they'll stand their ground and get the virus and they're just going to live their lives and they're not going to be afraid of this, that still those ways of doing things are still causing a massive overwhelm for our entire healthcare system. And what this means is that anybody who goes to the hospital, who goes into a medical environment of any nature, may not be able to receive the care that they need because the hospital and various other medical infrastructure are absolutely bogged down right now. And the only way to stop that, we will not fix this by having the medical community rise to the occasion. We have already risen to the occasion as best we possibly can. We're already dealing with massive quantities of patients that we're seeing, and it's the only way to win this is for people to do the right things. Please, I implore you, please, if you have not engaged yet, please do so now. In terms of what we need to do and what the challenges specifically are, we need to have a better way to keep people apart. It's really important that every single one of us realize that anytime two human beings who don't live in the same nuclear family, anytime those two people come together, there's a dangerous situation. We can't rely on people having symptoms in order to know who's infected, and we have to make the assumption that everybody potentially is a source of this virus. It's very important that every one of us look at things that way. One of the unique challenges, and a number of us have talked about this in private, is that most of us spend our time back and forth between public and private environments. And most of the response plan that we have come up with here in Humboldt County, that the states come up with, and other municipalities, other larger governments have come up with, is that we're dealing with public issues. We're dealing with behavior of people in public environments. And while that's fantastic, we've already done very well in the public arena. Businesses, since the very beginning, have been one of the biggest proponents that we've had. And we've had remarkably few cases. At one time, it was accurate that there had been absolutely no cases that were transmitted in public environments, in environments that are officiated by larger overseeing organizations. And while that's still probably true, we do not know specifically of cases that have been transmitted in public environments. It is possible that there have been several at this point, but I want to remind everybody that that number is remarkably small. The overwhelming number of cases are transmitted in private venues, in homes, residences, private parties and public places that are being used for private events, parties, things of that nature. That's where we're seeing this. And the problem with this is that we're much better at being able to officiate those public environments that really at this point have already done well. We don't have an equal capacity to enter private environments. In our culture, our private lives are something that we value very much. And I think our local government, the county, the city really respect these things. I think all of us do. And this presents a real issue because the problem is our policies don't easily enter private environments. And so we're asking each of you as private citizens in your own homes, inviting other people over, doing various private events, to please use your best judgment to realize that if you're having a dinner party, if you're having a birthday party, if you're having another type of an event at your house, get-togethers for Thanksgiving, that these have dangers associated with them. And that is exactly the way these viral cases are being transmitted. So our challenge as a health board, as a county, as a city, is that it's not easy for us to officiate the things that happen in people's homes. Most of us would prefer not to officiate these types of things. While the governor's directive absolutely does make some recommendations about these types of events, it makes no attempt at enforcement actions. And so it's critical that every single one of us realize that the only thing that's preventing this from really getting out of hand in Humboldt County is your actions in your own homes. Please, please do the right things, everybody. It's time for us as a health board to become more creative in being able to facilitate this. I think one of the shortcomings is that we really don't have the enforcement capacities. The governor has not yet enacted a stay-at-home order, and my hope is that that not happen. The reason is, of course, because it is particularly harsh to our community's businesses. But at the same time, at some point, we're going to have to come up with some type of a definitive way to be able to keep people apart from each other long enough to get vaccinations to come forth and to put us in a better position in this combat situation. So it's very critical that everybody do the right things for right now. As a health board, my hope is that we can come up with some more creative options, better ways to disseminate the message that people need to do the right things, better ways to encourage people to do those right things, and perhaps we can dialogue about that at some point at a future date or later during this meeting. In terms of specifics, there are some specific things that are going on. This morning, in response to the call that I received from Humboldt General Chief of Staff last night, a number of us had spoken last night and set up a drive-through clinic. This was done very, very quickly by officials at Humboldt General Hospital and within the Sheriff's Office and a number of other agencies, Humboldt County EMS. And a number of us got together last night by phone and then this morning in the parking lot at the West Campus Clinic in order to facilitate the setting up of the drive-through clinic, which will be operational very quickly here in the next couple of hours. So when people come through in order to be tested at the West Campus Clinic, many of those tests will be done while people are in their vehicles drive-through to minimize the amount of time required to process each of the patients so that the hospital is no longer overwhelmed. That's one of the mitigating things that we've come up with. We also likely will be calling in the National Guard at some point over the next several days in order to be able to help out. We're quickly running out of providers, having a very difficult time having enough providers to be able to see all the people who are coming through Humboldt General Hospital for COVID concerns, and we're working on that as well. A lot of these things take time, and I'm very appreciative of those folks who met this morning in order to expedite our plan. We're talking also about improved testing capacities. So far, most of you are aware that we're using Quest diagnostics at this time to replace the state for our primary source of nasal PCR tests, the kind of standard conventional tests that we're using. And this is going very well. Standard response times are 48 hours. We're able to get results back very quickly. And Quest is doing a faster job than the state laboratory, which was also an agency that was and is still overwhelmed at this point with the number of tests they're having to do. The Abbott rapid tests are still in short supply. we're trying our best to ration these and rely mostly on conventional nasal PCR testing. But there is one kind of a saving grace that we have at this point, and it's called the Binax test, which is also manufactured by Abbott. And Captain Wilkin is going to be able, hopefully, to procure 5,000 of those, which I think he'll be talking about in a few minutes. Public Health Nurse and Humboldt General Hospital together have about 2,100 of them. They're an immediate test, takes just a few minutes to get these. There's no machine involved, and there does not seem to be a backlog of orders. So it's just a wonderful solution. We're looking at that. Downside is that CLIA, which is a agency that officiates various testing, has not yet issued the license that we need in order to be able to do this at the state level. And we're attempting both through the Humboldt County Sheriff's Office and Humboldt General Hospital to expedite that so that we can get up and running on these new tests. Not quite as accurate as the other two primary tests that we're using, but they have just a fantastic advantage, and that is that they're readily available. And when we combine those with nasal PCR testing, the two together have a wonderful predictive value. So that's something that I'm very excited about. We likely will be setting up Rampart, which is the auxiliary hospital that we had used earlier during the pandemic. Thankfully, there were no admissions there. But my suspicion is at this point, because of the number of cases we're dealing with, I think it's very likely that we'll have to use that facility in the future. Trying to figure out exactly where we're going to locate that. One option is to put it back where it had been at the Indoor Event Center, but some of the administrative staff at Humboldt General Hospital are concerned about the ability to have the two facilities interface seamlessly, and for this reason, we're also looking into the possibility of using the parking structure at Humboldt General Hospital to expand capacity as they have at Renown. And so it's wait for more details on that. They should be available here over the next couple of days. In terms of vaccinations, one of the primary messages I'm hoping to deliver is that we've talked a lot about vaccinations and efficacy, the effectiveness of the vaccinations. And now we're asking for increased compliance. And I want to kind of dovetail those two things together so that people understand what the relationship is. I thoroughly anticipate that we'll have some great vaccinations that are available here, even over the next several weeks. It's going to be happening very, very quickly. The two front runners, of course, Pfizer and Moderna, are really looking fantastic, great efficacies, some logistical issues that are already worked out at this point, and distribution infrastructure, which I think Captain Wilkin will talk about, is also worked out. So we've got some great news, and the vaccinations absolutely will work and will give us a large degree of reprieve. But I think it's critical that everybody realize that we can get into very, very serious trouble even over the next 2 to 4 weeks that we're waiting for the leading edge of that to happen. And so it's very important that everybody do the right things, to socially distance, to wear your masks, and to realize that we're kind of at a crossroads. And hopefully everybody in the community chooses to do the right things voluntarily so that we're able to end this virus and get back on with our lives. I'd like to open up to questions and things. My guess is there'll be a fair number because of the nature of the information that I've shared this morning. So I'm ready to take any questions.
Thank you, Dr. Stringham. I appreciate your report. One thought I had is maybe we need to change the way we're talking to the public about doing the right things and why, and put out to the public that, because our hospital is at capacity, because Renown is at capacity, that you need to do the right things so that people that happen to get into a car wreck or people that have other complications such as pneumonias and heart attacks and things like that, that their service is going to be compromised if we don't. Maybe a little change up in that might be good.
I agree. I think that the two biggest communication challenges that I see us facing at this point, the first is that there really isn't a fantastic way that I know of to be able to communicate with everybody in the community on the same page. We've tried Facebook and other social media fora. We've also tried radio spots, a newspaper. We've tried the Spanish-speaking newspaper and a number of other things. even televised spots, which I think were fantastic. But in the early days of the virus, most of the people who were getting infected had indicated to the FAST team that they had never actually seen any of those news spots or had not been on Facebook. And so I think our biggest challenge is finding a method, an actual means by which to distribute a message. And then I think the second would be to perhaps make the message stickier and to hope to appeal to people on a slightly different level in order to be able to get this to happen. One of the things that we talked about was to have perhaps business leaders assist us in delivering these messages. The business leaders here in Humboldt County have been hit particularly hard by the virus. A lot of people's businesses are suffering, and which is very unfortunate for a number of reasons. The first is it's one of the reasons we have wonderful autonomy in our county, and it's one of the things many of us really enjoy is being able to do business locally. But the other issue is that by and large, the business leaders have been fantastic proponents and real allies of the message that we're trying to deliver, and they're doing it the right way in most cases. And yet they've still been hit much harder than other people. So to potentially have business leaders assist us in delivering the message to the general public that please everybody do the right things because it's our businesses that are being hit harder perhaps than other entities here in the county.
Do we have any other questions for Dr. Stringham? Commissioner French?
Thank you, Chairman. Dr. Stringham, you mentioned earlier that that the additional Abbott test, and I didn't get the name of the additional instant Abbott test that's out there, was being held up by the completion of the licensing for that use. My question is, from a standpoint of the health board or the county commission or the city council or leaders in our community, is there a role that we play at this time in order to fast track that and possibly get through that bureaucracy?
Yes. So the first is that the name of the test is the Abbott Binax test, and it's essentially an index card test. It does not require a machine to use, and it's just an absolutely fantastic test, very effective. In order to be able to use this test, we need to be able to have authorization through an agency called CLIA, which is an organization that oversees various types of testing in inpatient and outpatient facilities across the United States. And at the state level, a number of us have reached out to the state for assistance with this. And during this morning's meeting, several of us had kind of talked a little bit about this. Captain Wilkin has a number of different plans to be able to hopefully fast track this. We could potentially, even at this point, start doing the test under our pathologist, Dr. Mardini's license, but he's concerned about this, about actually doing this without getting CLIA authorization first. And I understand that. It would be some pretty massive implications if there were to be any type of a problem. So we have a couple of different avenues that we're working at this point. My anticipation is that within the next day or possibly two, we should have some information about what direction we would head with this. So we're working some avenues at this point. I also potentially have an avenue through Dr. Azam, the state's health officer, and he has the same position that I have, but at the state level. And hopefully he would be able to help us to be able to fast track this. We've got some wonderful avenues and we're working on those now.
So I assume then, this is Commissioner French again, I assume then that the CLIA is a government entity that operates out of CDC or something along that line, or is it a standalone organization? I'm not familiar with it. I'm just wondering if there's a way to get to that organization. It seems to me that we're at a critical juncture right now that we just simply can't accept them waiting for the bureaucratic machine to turn, so to speak, in order to get the licensing. I think it's something that at this stage we need to move quite a bit faster. And if we need to contact Congress or contact somebody within that realm in order to fast track? Wondering what our role is in that.
Those are wonderful ideas. I got the feeling when I talked to Captain Wilkin this morning that that he had some ways to be able to do this, and my suspicion is he'll probably be talking about this during his presentation. I can tell you that we've got some pretty good options, and I can also tell you that Captain Wilkin had shared this morning that one of the issues was that many other municipalities throughout the state are essentially in the same position, and that there was a backlog. But I agree, it's very critical, and I suspect very strongly that we'll be able to handle this here over the next 24 to 48 hours.
Thank you. And it's along the same line, Dr. Stringham. I'm also wondering about use of Quest right now. Obviously, we're not the only county that's seeing a spike right now. I'm sure they're being inundated with requests for tests. And I know in talking with the folks from Clark County, Quest, as they were overwhelmed with the Clark County increase in spikes in cases, their turnaround time went from 36 hours to 48 to 72, and obviously they were having trouble keeping up with it as well. I worry that we may be headed that direction with them now based on the numbers that are being processed, and I'm wondering if we have moved toward taking Renown and UMC up on their offer to provide testing for the rural counties in addition to Quest and the state lab, maybe using all of those tools in the toolbox to try to get a better result. Any thoughts on that?
No, I think those are excellent recommendations as well. So far, we've had good success with Quest, but we're seeing casual evidence that response times will likely increase, and then also, as you say, it stands to reason that that we're going to, as more and more cases come in from other areas, that we will absolutely inundate them also. So far, we have obviously a wonderful relationship with Renown. Renown is already doing some testing here in Humboldt County with the schools through the TIES Act, which is a Renown program that reaches out to schools and other entities to do testing. And so those response times are very, very quick. And my suspicion is that that Renown may have improved capacities to ramp up to the extent that maybe Quest and LabCorp may not. And Renown also services a smaller area of distribution and has more of a local interest. And so hopefully they would be in a position, as you say, to act as an additional tool. And it's a wonderful option. So I don't foresee a time that response times would go past 48 hours again. But I'd like to point out that Tony Fauci had said, and I love this comment, it's very true, we're not going to test our way out of this. And in the end, what we're looking for is good behavior and really where the contact patches, in this case, the rubber meets the road, when two human beings come together who don't come from the same nuclear family, those are the things that we need to focus our attention on rather than testing capacity and various other things. If we're going to win this, it can only happen by keeping people who are not involved in the same nuclear family respectful of the dangers and keeping people apart.
And one last question, if I might, Mr. Chairman, for Dr. Stringham. This is Commissioner French again. The one other question I had written down has to do with our hospitals being at capacity right now. And I'm wondering, I know there's a lot of reporting out on the ground right now talking about the improved therapeutics that are out there that are shortening the duration of the infections and minimizing the need for hospitalizations. I know there was some emergency CDC guidelines and authorizations made just this last week. So I'm just wondering what you could tell us on that, Dr. Stringham, and I guess based on that, what is the average turnaround time from the time somebody goes into our hospital with a COVID diagnosis to the time they're released, just on average?
I don't know what the average hospitalization time is. I can certainly find out and report back during our next visit. What I can tell you in general is that there absolutely are some wonderful therapeutics, some increased capacities that we have to be able to deal with these infections and to increase the probability that a person will survive the infection. But the real issue is that that it's a numbers game, and it's a number of people who are getting infected, and a certain percentage of those total people who are infected are going to wind up having hospitalization requirements. A certain percentage of those will wind up in an intensive care unit, and a certain percentage of those will wind up using resources that either protract hospital stays, make them longer, or increase the arduousness of taking care of those patients. And so I think that I would almost make the argument that as we have gained the capacity to do more for people, that we have protracted hospital stays, not minimized them. And so as you gain the capacity and increase the capacity to take care of people, the number of people who would benefit from hospitalization actually increases. And so I think that each of these things really are pointing in the same direction from my perspective, and that is that they're all serving as means to overwhelm this system. And again, the only thing, the only way that we're going to be able to resolve this is to create a barricade in people getting this virus. And so as we gain the capacity, increase the capacity to be able to do additional things, the one thing that rings true above everything else is that we have to be able to keep people from getting infected. It's the only part of this process that is winnable.
Thank you, Dr. Stringham. These are that great conversation for at least for me on this. I get a lot of questions along that line, and I appreciate you clarifying that.
Oh, thanks so much.
Yes. Okay. Thank you, Commissioner French. And I see a hand raised from Leanne Cushway, Chief Nursing Officer at HGH. Leanne, do you have a question? You're on mute. Leanne? Well, I don't see it. Commissioner Cherry, do you have a question or comment?
I guess it's more along the lines of a comment. You know, I think that I was taken back by what I heard today from Dr. Stringham in regards to the hospitals being at full capacity here in Humboldt County as well as Reno. And I really don't think that message is getting out to the public. I mean, we try to tell them how serious this illness is and take precautions, but there are stories, probably twice as many stories out there, whether it's social media or wherever, that says, you know, it's just the flu, it's nothing worse. Everybody's overreacting. I think that we need to probably, I'm not saying scare everybody, but, you know, there's the reality that it is serious and the hospital is full because of COVID. So that message needs to resonate. And I don't know if it's through Nicole's newsletter or what, but I think that would make a difference. That when, you know, the reality is that, yes, it is serious, and this is where we are today. Because on top of that, and this is another comment, the numbers that we see are alarming, the uptake in cases. But I also think there's a lot of cases out there that we don't know about, the people that aren't coming in and tested, and the problem is it is greater than we really know right now. And to what extent that is, we don't know that either. So that's my comment.
Okay. Thank you, Commissioner Cherry. Leanne, are you available now?
I am. I'm sorry, my mic wasn't working on the computer. I just wanted to, my name is Leanne Cushway. I'm the CNO at Humboldt Hospital. I wanted to answer some of your questions for you. We do have all the medications stocked at an adequate supply at the hospital. We have been using those, and we've had great success. So our average length of stay is 4 days from the time of admission until a patient can get home. They might need a little bit of oxygen support when they get home, but we continue with the paramedicine program. to assure that they're still progressing well after discharge. And I mean, you know, I appreciate Dr. Stringham's report. It was a very thorough report. We do have quite a few in the hospital currently. We've been able to get some patients to Idaho, but that's the only place we can transfer right now.
So Leanne, you say that's the only place we can transfer. So Renown is completely full and we can't transfer there at all now?
Yeah, we've been having problems even getting traumas to Renown. Renown and St. Mary's went on complete diversion yesterday, so they have no capacity. And we still try them just in case they have a discharge. It goes up and down every day. But Idaho has been able to accept it with no issue.
Thank you. Okay, Sheriff Allen, I see you have your hand up.
Thank you, Mr. Chair. I just have a couple of comments and one quick question. But along with Commissioner Cherry's about getting this information out a little bit more, I just think my recommendation would be to start an aggressive media campaign with all the media outlet sources we have once again, and hit the newspaper as well as the radio stations, get this message out for a couple of weeks at least to try to get this this information back out there. And the other question I would have for Dr. Stringham, when we talked a couple of weeks ago, or might have been a little bit more, the state was basically on about a 12 to 14 day turnaround on tests. Do you know if that has improved?
You know, to be honest, I'm not sure. My supposition is that it's still longer than it should be. And approximately 1 week ago, in fact, I believe it was last Monday, Humboldt General Hospital sent its last test to the state. And essentially what wound up happening was the wait times were just absolutely intolerable. So at this point, we've been sending, to the best of my knowledge, tests exclusively to Quest. And so the state's response time at this point is less relevant for those of us in Humboldt County because we're not using them at all at this point. In the event that the National Guard comes to do some community-based testing, which we're hoping that they do, my understanding is that the National Guard will use the state laboratory. And so in that respect, it'll be more critical that we know the response to that question. So
All right. Well, thank you, Dr. Stringham.
thank you.
Okay, we'll go. Commissioner Bell, do you have a question or comment?
Yes, Commissioner Bell. I just, along the lines like with when Commissioner Cherry was talking, as well as the, and having to do with the testing, the time waits are to the point where, I know of a few people that are just saying, well, there's no reason for me to go get tested because this thing will be over by the time I get tested. And perhaps in that realm could be why some of these folks are getting infected and that we have such a problem in our county. So other than that, I mean, we just have to continue to follow the guidelines and go through this and make everybody aware. So I agree with Sheriff Allen. We need to put this out in the media and get everybody on board. So that's all I have. Thank you.
Okay, thank you. I see County Manager Mendiola has his hand up. Go ahead, Dave.
Thank you, Mr. Chair. Dave Mendiola, County Manager. Mine is a combination of a comment, and then I do have a question for Dr. Stringham. And this is really going back to actionable items and doing the right thing. That was probably the main theme of your talk today. And I know that this board does not have any desire to mandate any kind of sanctions, and there's always that question of whether we even have the authority. But assuming the data is correct, that exposures and positive cases are coming from the private gatherings of family and friends, and very few, if any, are coming from the public locations, i.e. businesses and the like, which is something that I believe you confirmed earlier. Isn't it prudent to assume that the protocols that have been deployed by businesses since day one are working quite well? Would you answer? I've got more to this, but would you say yes to that?
I would. In fact, I think that the protocols that businesses using are not only working very well, but they also serve as a wonderful example that by doing the right things, by wearing masks, by keeping people apart, that absolutely is an effective strategy.
So Dr. Stringham, that being the case, then why would we not consider applying the same protocols in the private settings? And just so you know, I am probably the guy, and like many others out there, that said all along that that's a stupid idea. I'm not going to do that in my own home, and it's ridiculous to ask that. But the more I think this through, and because I've been thinking so much lately about what can we do from a practical sense that makes sense and that I think is actually doable. And I think if you take those same protocols that our businesses have been so successful with and apply them at home, for example, avoid large family gatherings if we can. I mean, again, we're not saying you shouldn't. We're just saying if you can avoid it, why don't you do it for Thanksgiving? And if we can get 2 or 3 weeks under our belt, maybe we got a different situation when it comes time for Christmas gatherings. Number one. Number two is a lot of times especially in Thanksgiving, we always invite a lot of outside people into our family for Thanksgiving, which is awesome. And it's one of my favorite parts of Thanksgiving. But maybe this time is a time to rethink that, because we don't know where other people have been outside of our nuclear family. And so maybe that's another thought. And then, of course, the regular thing is, and this is the part where I just rolled my eyes in the past, but now I have to say, I think I was wrong. And that is, if you're going to get together, okay, great. But let's avoid hugging our family members. Let's put a mask on when we're not eating or drinking. And let's keep our distances as best we can. That way we can still visit just like we would in the public setting, but we've got some protocols in place that might avoid that transfer of the virus. So my question to you then is, does that make sense to you?
Yeah, Mr. Mendiola, it absolutely does. And I think that the points that you've touched on are absolutely the points. That is exactly what I think. I think the tough part about this, though, is that the businesses have already proven that if we do the right things, that those transmission rates really go down and that things really help. And you're exactly right that the same things that have worked well for our businesses will absolutely work well in people's households. But the problem is this. The problem is that the businesses are actually doing those things and private residents are not. And the tough part is that in places of business, there are enough people who are watching. There are enough people who have access to the businesses who can actually walk in and out to make sure that people are actually doing the right things. Word of people who are not doing the right things gets back to people. We can make reminder phone calls. We can reach out to people with kindness and let them know that about them. But in private residences, those things don't happen. And so I think that what starts as a recommendation and is taken seriously by our community's businesses and in people's homes also starts as a recommendation and is not taken seriously. And so the other issue is that businesses almost have a ready-made handle. And the handle is in the form of a license, in the form of vicarious liability, in the form of all sorts of different accountabilities that businesses have. And in residences, people just don't. And so people don't tend to do the right things in residences. And I guess if we could come up with a way to encourage them more vigorously, or to deliver the message better, or to be able to say something or do something that would actually translate to action, our whole problem could be fixed.
So Dr. Stringham, having said that, I've been thinking a lot about how do we get that message out to our community. And so I will work really closely with Nicole Maher. We've already had some of these discussions. But I think to piggyback on Chair Tipton's comment earlier about the fact, and Commissioner Cherry, where, you know, this concern that our hospital is being overwhelmed already, that we appeal to the public to do these things for a couple of reasons that are all really important to the health of our community. One is the hospital issue, that we have to take action now to avoid overwhelming our hospital. The other issue is we have to take these actions in the privacy of our home, because we're going to these businesses. Nobody wants to shut down. Nobody wants them to shut down. And if they do shut down, it's a disaster. It hurts people hard in the pocketbook, mentally, from mental health issues. We've already seen that, and it's not a good situation. And so let's all work together in the privacy of our homes and amongst our friends and family to do the right things, so that we don't get in a situation where we force the state's hand to close businesses, which only hurt us. And of course, hurt our residents, because if they go for a really serious emergency, what we would dub as normal, they may not be able to get the kind of response they normally get from the hospital because they're overwhelmed. So I think those two reasons alone are a reason why, you know, that we really need to look at this not as just, you know, my personal rights, but what's best for our community. We have to do the right things. And that's just my thought.
Thank you, Mr. Mendiola. Do we have other questions for Dr. Stringham? I saw someone else raise their hand, but I don't know who it was. And are there other questions for Dr. Stringham? Okay, hearing none. Thank you, Dr. Stringham, for your report. I appreciate it. It's a good report as always. We'll move to Captain Wilkin now. Captain Wilkin, are you available?
Give me a minute and I will check real quick. This is Sheriff Allen. I know he's on another conference call as we speak.
Okay, I'll wait just a moment for you.
Mr. Chair, I do see him on the line, so that probably.
Let's go. Excuse me, Dave, you see that he is available or he is not?
Well, he's on the line, so.
Hello.
There he is.
Oh, okay. Thank you.
Sorry, it wasn't working in my office. I could hear you, but I couldn't talk to you, so I ran down here. So I'll start off with the Binax Now tests, since those were discussed. So we have the resource request in. We've been allocated 5,000 of those tests. I'm just waiting on the warehouse to call me to come down and pick them up. So once we do, those will be delivered to Humboldt General Hospital. The CLIA waivers that we're talking about, I know they're in a process for the CLIA waiver. A lot of agencies through the state are going through that with trying to get the waiver, get them set up for their labs, and have those in place. They are moving them through as fast as they can. You know, and I heard what the commissioners were discussing with the potential issues there and wanting to get that process through faster. I do know that they are trying to expedite them and they're trying to do their best to help us out in the counties. With the microbiologist issue was discussed, I just brought that up in the other conference call meeting that I was on. They're going to send me the information for the Battleborn Medical Corps. So hopefully that'll help us start sourcing some medical staff for the hospital if we need it. And I did put it out to the other entities that were on the state call this morning of, hey, these are some areas that we may need some help in. So maybe we can start getting some more information for those resource requests and hopefully be able to get those filled faster. You know, the Binax Now tests, those are going to be a good thing. They're going to help us test more people. It is a much more rapid result. It's about 15 minutes to get a result in one of those tests. And it's a really good resource that the state reached out to provide for everybody. So that's going to be a good thing. You know, emergency management's been busy. The vaccine coming up for the tier 1. We had the conference call for law enforcement yesterday with this. To the other entities that are in the county, all of our tier 1 folks that should be on there, I had those numbers ahead of time, so those have already been submitted for the state. We're budgeting for 730 Tier 1 employees here in Humboldt County. That should more than cover everybody that falls in under first responders, health, those 10 tiers that we talked about in a previous health board meeting. So I do want to reassure everybody, we did get those numbers in. We are making the appropriate tests, and we're starting on our Tier 2 numbers. So I've been working with Able and City of Winnemucca for getting those in. The Tier 2 has a lot more moving parts to getting those numbers together than the Tier 1. It's a really large group. So that's going to take a minute to get all of those, and it'll move into the Tier 3. One of the things that I'm working with the state, because I don't like the idea of waste on these vaccines, is if we have excess vaccine that's still in that 4-day usable window, if we can bump those down into the Tier 2 and get some of those folks vaccinated earlier, so that way we're not wasting vaccine, because the idea of throwing something away is ludicrous to me. So hopefully we can get approval from the state to do that. I think that they're giving us some leeway in who we determine is in our Tier 1 and Tier 2 groups. So I want to really see anybody who can be affected by this that's working in these groups be able to receive that vaccine if they choose to do so, because it is a voluntary program for folks. And so, last couple of weeks has just been exceptionally time consuming with emergency management, putting together these numbers and getting this stuff coordinated with the state and our state agencies. Marcia Foreman from Public Health has been great about working with me and helping me out on getting this vaccine program together. We are in constant contact with the state. We have been since I returned. And so we are working forward on getting these things completed. So any questions on anything?
Yes, Captain, I got a couple. Is it a Binax or Binax now?
It's Binax now. It's BINAX, and then now is a separate word. And these are made by Abbott. So it's the same company that makes the rapid tests that we were able to procure at the beginning of this. So Abbott is the one who's also distributing and putting these tests out. I can forward you a link on it if you would like to be able to read about it. They've got a great website with a lot of information. If you just Google search it, it will bring that information up on this test. It's a simple card and swab, and the swab goes into the card, and you have a result within about 15 minutes.
Okay, thank you. And do you have any other information or any more information than what we heard earlier from Dr. Stringham on the auxiliary hospital?
So speaking with Jordan Kohler this morning, it sounds like they are going to put that up today, and it looks like it's going to go into the parking garage over there at HGH. And if there's somebody from on HGH, if I misspeak, please feel free to correct me. Okay. So that is going to go up at HGH. And the reason why is it's easier for the continuity of operations and to provide services if it's at their main campus, and easier for them to staff. So it does look like that's going up. The call that I was just on, hopefully St. Mary's is going to be discharging some folks today and opening up some beds at St. Mary's Hospital down in Reno. But unfortunately, what we're experiencing here is at the statewide level and at the nationwide level. So we're not unique in what we're experiencing, and in some ways we're actually doing really well in our community, but this is becoming an issue. Unfortunately, this is the resource shortages and the bed shortages. It's being experienced all across the board throughout our state. I'm hoping with reaching out to Battle Board Medical Corps that we can start setting up resources that we need if we need additional personnel here at the hospital. And for those of you guys that don't know, Battle Board Medical Corps is something that was set up under the state's directive specific for this health response issue. Everybody's just in a tight spot with this. Hopefully opening up the offsite hospital opens up Saved HGH. I'm still hopeful that we don't have to move people into that facility, just because I want to see the health in our community do well and people stay healthy. But I don't think it's all doom and gloom. I think that we're seeing a surge and that we have to do our best to manage that surge and utilize the resources that we have to our best advantage to be able to take care of our community. And so far, I think that especially where we started early this morning, with our meeting and moving forward with things, I think that as organizations, we are doing our best with this and, doing what is the right thing for our community to keep things moving forward and protect the health of our residents here.
Thank you, Captain. Do we have any questions for Captain Wilkin? Commissioner Cherry?
No questions.
All right, Commissioner Bell?
I have nothing, thanks.
Commissioner French?
I have just one additional question. Are we right now accepting, it goes the other direction as well. Are we accepting potentially patients from other rural hospitals such as Battle Mountain, Pershing County, or Elko at this point? Have we, and do we have a policy of that right now? I know they're experiencing the same kinds of issues we are.
Commissioner, my answer to that is not that I am aware of, and in this morning's discussion, that was not brought up to me. My understanding is that they're going to send those patients to bigger facilities. So those are going to look at going to Reno, Utah, or Idaho if they need a higher level of care.
And with regard to the Vinex instant tests, are those tests in? Are they in inventory right now, waiting to be allocated, or are we waiting for them to show up from someplace else? I'm just wondering about when we could expect them.
Sure. My understanding is that so right now on my end of it, Commissioner, all I'm waiting for is a call from the state to come pick them up. So Humboldt County has been allocated 5,000 tests based on the resource request that I submitted. And I believe that they're at the warehouse getting ready to go out. Just like the other tests, they are a very popular, very controlled item. Same thing for the vaccine. I received an email today that the vaccine, when it moves from place to place, will be law enforcement escorted here in our state. So it's just getting controlled items out to the end users and getting that CLIA application through. They are allocating us the 5,000 tests. So as soon as I have an answer, it'll be just like last time. We'll go down and get them that day.
Great, thank you.
All right, thank you, Commissioner French. Sheriff Allen, you had
Hi. Yes, I do. Is what I want to do is I want to commend Captain Wilkin for the job he's doing as the county emergency manager. I get to see on a daily basis how much work he puts into this, how much passion he has to make sure the community is safe as possible on this. And I don't want it to go unnoticed. And I do appreciate all the work he's doing for the sheriff's office in the county, as well as Captain Lininger. We've been able to keep COVID out of the jail. We had one case of COVID in the jail since March. The protocols that we have in place have proved to be invaluable in trying to minimize the contact that we have within the jail and everything. And all I can do is knock on wood that we continue that process that we have in the jail. But we did send Captain Wilkin to an emergency management training about a year ago. This has also proved to be invaluable. All the work that he's doing, not only as a patrol captain, but as the emergency manager, just needs to be recognized on this. And it's constant communication with the state and numerous other resources that are out there that can help us through this. And what if you guys could see on the inside what I see daily, I think you guys would agree with me. And I just want to make sure that he is recognized for all the hard work he's doing. Thank you.
Thank you, Sheriff. Yes, and we do appreciate the work that Captain Wilkin is doing, as well as many others that are working on this. Dr. Stringham, do you have any questions of Captain Wilkin?
No, I sure don't. Excellent and very informative presentation. Thank you very much, Captain Wilkin.
Any other questions of Captain Wilkin? Okay, thank you, Captain. Appreciate it.
Mr. Chairman, this is Mr. French. I had one additional question for Dr. Stringham that had a question come into me here a few minutes ago. Are we currently, based on your conversation that you had with the hospital last night, Dr. Stringham, are we currently turning away patients right now based on the fact that we're overloaded?
No, I do not believe that that's the case. And the hospital is in the process of being able to expand services. So I do not think that there's any risk of Humboldt General turning patients away at this point. I have not heard that, have not even heard rumors of it. And I know that those folks at Humboldt General Hospital would do absolutely anything in their power to make sure that that not happen.
Great, I appreciate that. I just had a question just came in on my cell phone.
All right.
Mr.
Thank
Chair.
you. We're going to change up things a little bit right now. Instead of going to Nicole for her report, I have the CEO at HGH on the phone, Tim Powers, and we'll hear from him, and then we'll go to Nicole, if that's okay.
Thanks very much, Mr. Chairman. I, just to provide everybody some, information about what's been going on here at your hospital. And we had a board meeting last night, and I kind of passed on this observation as well. Everybody in this community should really be proud of the efforts and the can-do attitude here from all of our clinicians, our caregivers, our support staff. I mean, the whole smash here. We've got a group over at the West Campus that, we used to comment under siege with the number of patients that have been presented over there. And everybody here has really rallied around the necessity to really put up and do what's needed at this point in time. I know the question came up about turning patients away. That's never going to happen here. We will take everyone at any time. And we've got a great coordination of clinical care here, working with, as was mentioned earlier, really the only available space and bed availability is up in the Boise area at St. Alphonsus. So our partner up there has been really, really good about helping us out during this time of need. And I don't see that, ability going away anytime soon. As was mentioned, we are deploying Rampart in the covered garage. We are making certain we brought in our environmental people to make certain that the outside exterior area of Rampart will be well heated, that the climate will be a climate that will not put, any undue inconvenience, if you will, to the patients down there as well as our staff. It's locally convenient to our ancillary services, lab, imaging, and we think that's a really good place on campus to maintain that particular facility. Again, it's something that is quite extraordinary this time through. A statistic was thrown out, and Dr. Stringham, this as well as anyone, and all the other folks on this call, but over the term of this pandemic, over 25% of the positive cases have presented themselves at the hospital within the last 2 weeks, and that's an extraordinary amount of care that's necessary to be provided. But suffice it to say, Laura Shea is in my office with me, who's our public information officer as well. We will make certain that the community is informed from the hospital's perspective on available services here, timely information about any updates on our West Campus clinic schedule, our walk-in clinics, and make certain that the word gets out that, to really combat this the best you can, staying away from really protracted groups at this point in time is the best remedy we can offer. And we will be, vigilant in making certain that the highest level of care is provided to our community as they present themselves to our hospital. Leanne, I know our CNO is on the phone as well. I will certainly appreciate your input and you passing along information to the group as well, if you would.
Sure, absolutely. Thanks, Tim. So, like Tim said, this has hit us pretty hard within just the last few days. Our county, per CMS, we saw a spike between November 5th and the 18th, where 46.7% of all tests were positive. So that has put Humboldt County in a red status for the CDC and for our state. Monday, like Tim said, we were under surge. We saw 107 patients. 50 of those were symptomatic in the screening clinic. We had to turn people away, unfortunately, that day because we just did not have the manpower to do more than 107 people. So we are working on a plan to roll out drive-through asymptomatic and continue to see the symptomatic within the clinic. The provider is seeing 40 to 60 patients per day by appointments. Today we deployed another provider over to the screening clinic to help her out because she's booked solid with appointments throughout this next week even. So we're starting to see the flu in addition to COVID. So it's not everybody's COVID, but we are seeing influenza A and B coming into the ER and into the clinic. So some of these patients do need treated. Like I said before, we do have medications. We have adequate supply for medications for outpatient and also inpatient. Inpatient-wise, like Dr. Stringham shared, capacity has been a challenge. Currently, we have 5 positive COVIDs in-house, and part of the challenge we're having is long-term cares, rehabs, behavioral health centers, and home health is not supporting us if a patient is COVID positive. We've had to hold behavioral health patients here for 2 weeks that are COVID positive because those centers will not accept them. Same with rehabs and long-term care. Most facilities are closed to admissions because of exposures. We're also closed to admissions in our long-term care because we are a red zone per the state, and we've had an exposure. We've had an employee that tested positive in long-term care. Thus, it shuts the whole ability to admit over there down because the staff have to be tested twice a week and the residents have to get tested twice a week. So we currently can't even admit to our own long-term care, even though we have beds there. Now, we are hoping that can open up soon, but we've got 13 staff members out between the hospital and long-term care that have tested positive for COVID. So staffing has been a challenge. We have an amazing team. Everybody's pulling together. We have support from the clinics. I do have travelers that are starting Monday of next week that we were able to procure before the surge happened. Like Officer Wilkins shared, we are short in lab. That's one of our critical areas right now because I only have 1 microbiologist, and these rapid tests do need lab support. So we're trying to work on that right now. To kind of help with staffing and the surge, we made a difficult decision yesterday, but wanted to stop elective surgeries. We will continue to do emergency surgeries, but elective surgeries, we're going to have to halt for a while until the surge kind of dies down. The clinics, we are going to encourage telemedicine instead of patients coming in. The clinics have been seeing people coming in that are symptomatic that are also positive for COVID, and this is a high-risk exposure for the entire hospital and for the clinics and the providers, so we need to encourage telemedicine visits as much as possible. Tim and I have been talking back on swabbing. We did have a phone call with UMC in regards to them maybe helping with some of the tests. Even though Quest has been very good. I mean, they have been able to turn our results around within 48 hours. We wanted to have a backup. We're still trying to work out the logistics with UMC because things would have to be sent down by FedEx. And so we're working on that with UMC right now. We are not turning anybody away. We have had some patients from Pershing and Battle Mountain that did need our services that we did accept. You know, there is Elko. I see every day they do have capacity still, So I was going to reach out to them if we do get overwhelmed, maybe they can assist us. But we're doing everything possible. And like Tim said, we won't be turning people away. We have rooms still available. We have a surge plan in place internally and also setting up the garage so we can expand our capability.
Leanne, what is UMC?
That's the hospital in Las Vegas that now is doing swabbing internally. They're doing it, and so is Renown. And they're running about 11,000 tests per day, and they said they could assist in running some of our COVID swabbing if necessary.
Okay, thank you. Do we have any questions for either Mr. Powers or Ms. Cushway?
This is Commissioner Cherry.
Go ahead, Commissioner.
I don't have a question. I just have a comment. I want to thank all the health professionals over there at the hospital who will be missing Thanksgiving because of this COVID thing and taking care of the sick. So we really appreciate the hospital.
Thank you, Commissioner Cherry. I would echo those comments. Commissioner Leanne, would you state your last name for the record?
Oh, sure. It's Cushway, Cushway.
Oh, thank you.
And Mr. Chairman, this is Tammy, the clerk. Could I
Yes.
also get her title?
So I'm the Chief Nursing Officer.
All right, thank you. Any other questions? Commissioner French?
I have none other at this time. Thank you.
All right, County Manager Mendiola?
Mr. Chair, Dave Mendiola, County Manager. I just wanted to echo the thanks to HGH. Mr. Powers, you know, historically, since I've been here, it's been a struggle communicating with the hospital. You've changed all that, and I can't tell you how appreciative I am that when I call, I get a call back within minutes, and your staff is great. So I just happened to have been in your ER on Friday night, and by the way, they were awesome. They did a great job, and I appreciate Jim and everything you're doing. Thank you.
Thank you very much, Dave.
Commissioner Bell?
As Commissioner Bell, I'm fully aware of all of what we got going on at the hospital there, and like I say, we're just everybody's doing everything they can, and it is very much appreciated from everybody. So thank you.
Dr. Stringham?
I'd like to say thank you very much to members of Humboldt General and to the entire medical community, law enforcement, fire, EMS community. I really appreciate being part of the team, and I know how much work all of us are putting in, and I really appreciate what everybody.
Thank you. Sheriff Allen, any questions or comments for?
I would just echo my same thoughts with appreciation to everybody who continues to work hard to try to mitigate this virus. Thank you.
Okay. Any other questions for our CEO or our CNO, the hospital? No. Well, thank you very much, and we look forward to having ongoing conversations with you on our County Board of Health meeting. We'll move now to Nicole Maher, our Public Information Officer. Nicole, are you ready for your report?
Good morning. Can you hear me?
Yes.
Okay. We'll start this morning with Fort McDermott. Fort McDermott has 140 cumulative cases. That's up that's up from 114 just shy of 2 weeks ago. 26 new cases. As of today, McDermott has 126 recovered and 13 active cases. Marsh's office, the Office of the Community Health Nurse, is closed until Monday, November 30th, as a special precaution due to COVID-19 exposure to staff members. Golden Valley and Ridley's Pharmacy continue to test for COVID and have been helpful in clearing some of those confirmations for us. As Dr. Stringham mentioned, Humboldt County School District held a testing event where over 50 people were screened for COVID and one staff member was confirmed positive. We sent out another notification last week to residents as part of the City of Winnemucca's wastewater testing program. I think in all we sent to about 230 people in the vicinity of the Lowry High School manhole. They were notified of a possible upward trend in their vicinity with encouragement to be tested at the first sign of symptoms. On Tuesday, as has been mentioned, on November 17th, that's when our very first results started going to Quest, and so we've been doing that for about a week now. And last week, our first results showed up on Friday, so everyone was excited about that. That has helped immensely with our local contact tracing efforts. FAST team is in the process of adding more members to ensure the county is fully prepared to deal with this continued surge. Those new members are going to be really important, and I just want to send out a shout out to our folks who are really helping with this, especially Jonathan Pritchard and Ali Garcia. They have been amazing in holding us down through this really trying time recently. Last Monday was the second week in a row that Humboldt was flagged by the COVID-19 Mitigation and Management Task Force for high case rate and high positivity rate. We presented our updated jurisdictional assessment action plan to the state last Thursday, which was approved.
Nicole, Dave Mendiola here. I'm sorry, I accidentally muted you.
All right. Can you hear me now?
Sorry about that.
Perfect. Thank you. As has been noted, Humboldt County is working on additional testing in partnership with the hospital. So we'll share that information and make sure people know where to be tested. That continues to be one of the main questions I get. And of course, Captain Wilkin continues to finalize our vaccination plan. Patty Tyndall at the Senior Center continues to be amazing and watching out for our older, more vulnerable population. She's been working on establishing a COVID route for Meals on Wheels. For the first time this month, we have had seniors who have that need. We've also pulled in some other folks and are looking at some other things, including having Nikki Lynn with the county, who is also amazing, interface with our case managers at the hospital, just to watch out for anybody who's getting released who might need some extra support. And as has been noted regarding hospitalizations, Commissioner French asked for a report on hospitalizations overall. So over the past 2 weeks, currently 8 Humboldt County residents are hospitalized, as has been noted, 5 locally. And over the past 2 weeks, a total of 10 people have been hospitalized, including 7 locally. And to my knowledge, and Leanne can correct me if this isn't true, but no ventilators are in use locally. As far as our situation report, the state is up just over 25,000 tests from 2 weeks ago, cases from 2 weeks ago, tests just shy of 200,000 from 2 weeks ago, deaths statewide 170 from 2 weeks ago. Humboldt, we currently stand at 311 cases, 236 recovered. I know that we will add several dozen today at least, and we still stand at 4 deaths, no change, thank goodness. Washoe County up just shy of 6,000 cases from 2 weeks ago. Clark, up 17,000 cases from 2 weeks ago. Lander, up 57 cases from 2 weeks ago. They're currently at 182. And I'm assuming, based on what's happening here, that they're probably close to 200. Pershing really shot up over the last 2 weeks. They're up 55, currently standing at 85. And Elko, our poor neighbors to the east, continue to struggle, up 1,052 cases from 2 weeks ago. They're currently at 2,445 cases, 17 deaths. So let's look at Nevada really quick. Nevada broke its daily COVID-19 case record on Monday, reporting just over 2,800 cases, but the state has routinely been reporting well over 2,000 new cases a day for several days now. 2 weeks ago was when we began reporting approximately 1,000 new cases a day. State's also reporting record high hospitalizations and a high positivity rate. They're currently at 16.6%. When we met 2 weeks ago, it was 13.7%. As of Tuesday, yesterday, hospitals, statewide hospital occupancy rates are 81%. That's up from 79% 2 weeks ago. ICU, 68%, up from 65%. And ventilators in use, 35%, up fairly significantly from 2 weeks ago when we were at 29%. 5 Las Vegas businesses received citations in a recent sweep for COVID safety measure compliance. And as I'm sure you all know, Governor Steve Sisolak announced a statewide pause Sunday to help slow the spread of COVID-19 in the state, and the measures went into effect yesterday and will last for 3 weeks. That's all I have. I'm happy to take any questions.
All right, thank you, Nicole. Do we have any questions from Nicole? Commissioner French?
I have none at this time. Thank you.
Thank you. Commissioner Bell?
I have none at this time. Thank you, Nicole.
Commissioner Cherry?
I have done. Thank you.
Dr. Stringham?
No, I don't have any either. Thank you.
Thank you. Sheriff Allen?
No, I don't either. Thank you.
Okay, thank you. Do we have any questions from the public for Nicole? You have to *6 to unmute yourself if you're on by the phone. Okay, I don't have any other questions either. Before it slips my mind, I want to remind any of the businesses that are on this call that are listening that the county does have quite a lot of masks and sanitizer available for you. If you need some, you can pick it up, call the comptroller's office or call the county office and make arrangements for it. They'll put those 2 items together for you and you can pick it up at the courthouse. What's our next item, County Manager?
We've actually already done the Humboldt General Hospital update, so we'll pass on that. Next up is Alicia Heiser, updates on City of Winnemucca wastewater testing, COVID-19. A presentation by Winnemucca City Manager Alicia Heiser to provide information regarding ongoing wastewater testing plans and results as it relates to forecasting the outbreak of COVID-19, informational only.
Alicia.
Hello, good morning. I will share my screen, I think. So what I've got up here is our wastewater graphs for this week. And so we're actually looking at samples that were collected last week on November 17th, and I received the results earlier this week. So hopefully I'm bringing some good news. It looks like our concentrations are down. So I'm looking here at this 465 cumulative concentration of copies per milliliter. So this is significantly down from the previous 2 weeks. I'm hoping that means we'll have a calming of caseloads over the next couple days to maybe a week. I think right now the spike in cases that we're seeing is still a residual of these 2 very high weeks in coronavirus concentration in the wastewater. One thing that I am watching a little bit is the concentration that showed up at our sewer treatment plant. So even though the overall cumulative concentration is down, the concentration at the treatment plant is actually the highest that it's been so far. And one reason why I'm watching that is typically that sample comes back with some amount of viral RNA, but it's usually very diluted because it has all of the wastewater from the entire city. So by the time it reaches the treatment plant, it's pretty diluted. This week, it's our average was 73.2 copies per milliliter, which is higher than we've seen before. And so even though maybe we had lower concentrations at some of the other manholes, it may have been the time that we collected the sample or just several other variables, but we are seeing a little bit higher of a concentration at the treatment plant. So I'm not sure if that's meaningful or not, but just something I'm keeping an eye on over the next couple weeks. On this next graph, oh, it's actually before that, this just shows our RNA in the wastewater over time and its correlation with our cases per day. So this was our largest spike back from the samples collected on November 3rd. And I think we're still in that spike right now, but I'm hopeful that we'll see a decline in cases per day corresponding with these 2 points in the coming weeks. And that's all I have, unless anybody has any questions.
I have a question for you, Alicia. You had indicated a couple of weeks ago that you were going to be able to try to take out Lowry High School from the Lowry High School area. Were you able to do that?
We have not done that with our testing yet. If the school district asked us to do that, we could certainly try. The manhole that we collect at, it has the flow from the areas above the high school, and then there's another pipe that comes directly from the high school. So we could try taking a sample from that Lowry pipe before it mixes in with the rest of the wastewater. But for now, we've just been collecting samples of the combined flow, which gives us the total area.
All right. Does anyone have a question for Alicia? Commissioner French?
Thanks, Mr. Chairman. I just have one kind of a 30,000 foot question I think we all should be thinking about. And it occurred to me as we were going through Alicia's presentation from the wastewater, and that has to do with the availability of funding to continue this kind of testing. And I'm with the loss of the CARES funding in the 30th of December, I'm wondering what is the long and short-term plan moving forward with continuing these services absent the funding? Has anybody really given so much thought to that at all?
Well, this is Alicia. I'll answer it from the city's budget's perspective, I guess. Right now, we are absolutely using CARES Act funds to pay for these tests. And when it gets to December 30th, I'm really going to have to look at our budget, I guess. And I'm not sure that this would necessarily fall under our sewer fund budget, because our sewer fund is an enterprise fund, which is funded by use fees, I guess, and it's for maintenance of the line, but it doesn't necessarily cover this type of testing. And I think the city, the county, everybody knows that general fund budgets are typically tight. So we may be able to carry on for a short amount of time, but we definitely wouldn't be able to continue at least at this magnitude, 5 tests per week. We wouldn't be able to continue that for very long.
Thanks, Alicia.
Mr. Chair,
Mendiola?
Yeah, Dave Mendiola, County Manager. So Gina Rackley, our comptroller, and I have had a couple of discussions about this going past December 30th. One of the things that I'm going to talk to Gina about, as well as our auditors, is we do have a line item in our what we call our other general government fund called contingency. And that's usually something you can't tap into unless it's an emergency situation. So I think what we need to check into is to find out if that is something that we can tap into under, because we are under an emergency condition here. We've done that here in the county as well as the state. So we'll check into that. But of course, we've got some other areas that we'll look into. So going forward. Now, I really do fully expect, I've had a couple discussions with some congressional members, that there will be a move afoot to extend the CARES Act funding. It's not something that's, I wouldn't say it's not high on their list, but it's until we get through all of these legal challenges on the voting and those types of things, I don't think you're going to see a lot of tremendous activity. But once that's completed, which would be first couple weeks in January, I think that my guess is we're going to see an extension and or additional funding come in for that. So hopefully that will happen.
Thank you.
Great, thank you.
Commissioner Bell, do you have any questions?
No, I don't have any other questions. Thank you.
Thank you, Commissioner. Commissioner Cherry?
Kind of off point here a little bit, but it does pertain to tracing. How is this overwhelming our contact tracers, and how's that progressing? Are they able to keep up with this surge?
Commissioner or Dr. Stringham, you want to take that?
Yes, I think I can answer that. We've added a number of new contact tracers, as Nicole had mentioned, and the team is doing a great job. People are generally working very well together. We have kind of some organizational issues that we need to work through, and the other thing I can say is that if you have applied to be a member of the team and have not yet heard back from us, be patient. We're working on the applications at this point. So we're not being overwhelmed at this point. I think we have enough contact tracers to be able to work. If the cases get much higher, then at that point we may have to come up with more creative ways to be able to finance this, because the number of positions that are available through Great Basin College is finite. And so if we needed additional contact tracers, we might have to look into other means by which to bring them on board and to pay them. But for right now, things seem to be going very well.
And here again, this is the paying these tracers is dependent on the CARES Act and continuation of those dollars, correct?
Yes, right now my understanding is that the monies are ultimately coming, the ultimate source is CARES Act funding, and that's being shunted through Great Basin College for the majority of our contact tracers. And I believe there is one or two who are still with Manpower when they were originally brought in as well.
Thank you.
Okay, Sheriff, do you have any questions of Alicia?
No, I don't. Thank you.
Okay. Who else didn't I call on? Commissioner French?
I didn't have any additional at this point, other than the fact I wanted to ask Sheriff Allen if the COVID outbreak is showing up at the jail much at all, either with the inmate population or the personnel.
Really, Commissioner French, no. Like I said earlier, we've had one case that was about 2 months ago. We were able to mitigate that, and it was an inmate, and we were able to mitigate that real quick. And the person was OR'd after it came back positive. We do quarantine everybody that comes in that has been arrested for a period between 10 and 14 days. With the new nurse that we have, this has just been one of the best things we could have done. She is able to test the inmates as they come in, and her tests go up to McDermott, to the Indian Health Services. They've had a shutdown recently because of a I think I heard 3 positive cases up there. But overall, our agency right now, we do have 3 positives within the agency as a whole. They are home self-isolating. To the best of our knowledge, nobody has been infected as a result of those positive tests. We were able to jump on it very quick once we found out and took some emergency protocols into place, and we limited the exposure to everybody. So, once again, knock on wood that we continue to be able to dodge that bullet as it's thrown at us. But our agency is overall healthy, and nothing. Your original question, nothing in the jail. They're all right there. But I think that nurse is bringing a lot of that assistance that we needed into the jail.
Excellent. Thank you. Thank you, Sheriff.
Thank you. Does anyone have any other questions for Alicia Heiser, City Manager? Hearing none, then County Manager, do we have any other items on the agenda?
Mr. Chair, Dave Mendiola, County Manager. The last thing we have on the agenda is the approval of the high-risk mitigation plan for possible action. Consideration, discussion, and possible action to prepare and approve a plan to mitigate the county's status as a high-risk county for COVID-19. Discussion and possible action. Just so you know, on that front, I've been working closely with Nicole Maher, Dr. Stringham, Captain Wilkin, and others. As you know, the first time we showed up on the high-risk list with the state, a little over a month ago, we came off of it for 1 week, just prior to this very large outbreak. We've been back on it ever since. And so what we're required to do is prepare a rather extensive report based on all of the things pretty much that you've heard today on the call, from hospitalizations to response, vaccination, testing, etc. And so that report has been pretty much the same. We got to pass this week primarily because of Thanksgiving. We'll be back in that mode where we literally get on the phone and we have to defend our plan to the state. It's a good process because I really think when you listen into the other counties, you get some other ideas. And so I think what I would say about that, and I'd like Nicole to probably jump in here as well, and maybe Dr. Stringham, is that the major change for us is a focus on what we've talked about today, and that is messaging. How do we get the message to those folks in the private sector where we're having these gatherings, which is really the source of this outbreak? And so we've been talking a lot about how we can come up with some, as you know, we've talked about flyers, social media, the press, etc., to get a message out that talks about not just doing the right thing and saying doing the right thing, but giving very specific examples. And that's why I asked the question to Dr. Stringham about the efficacy of using the same protocols that businesses are using for the private sector, because somehow we need to be able to say that in a quick, easy way, and with the overlying understanding, in my opinion, that this is not just about you and or your family, but it's about our businesses and keeping them open and their health and their families whole, because if they go out of business, that's a bigger problem. But it's also about our hospital and supporting our hospital so that they really can take care of not just COVID, but also the regular illnesses that come through the door on a daily basis. So that's the outreach message that we're going to try to deal with. The other part that we have been asked by the state to beef up is our enforcement area. And to be really honest with you, that's one that we kind of push back on, generally speaking, because first of all, you know, it's a very difficult thing to when you, and I think Dr. Stringham touched on this, is how do you enforce something in the private setting? We just do not, even if we wanted to. Okay, even if we wanted to beef up and send law enforcement and or come up with a group of people Private people walking up to people's doors. First of all, nobody wants to do it. We don't have the resources. And in my mind, I think you endanger people even more. So we've kind of pushed back on that front because I don't think that's going to happen. But I think what we can do is I think we can actually achieve both through the messaging campaign and get people to understand. But I think, in my personal opinion, the most important thing is for every one of us on this call, and at one time we had 42 on the call, to reach out to your immediate friends and family and profess the importance of doing this, and then ask them to reach out to their immediate friends and family. That word of mouth thing that should be led by this idea that, stop thinking about it as a personal right or things like that. Start thinking about the fact that let's keep our hospital in good shape so we can take care of people. Let's keep our businesses open, because if we keep going at the rate we're going, you know what, the state will come in and they're going to mandate shutdowns of our businesses, which they can do, and that's going to hurt us. So I just wanted to give you an update. That's really, I think, the core focus of our latest plan that we're sending into the state. And I don't know if Dr. Stringham or Nicole have any further comments on that.
No, thank you very much. I think that I agree 100% with everything that you've just said, Mr. Mendiola. I think that these are the pivotal issues. And I think that to design a campaign that would address the two biggest single issues that we have, number one, a method, an actual means by which to reach out to people, be it social media, radio spots, television, various other things. So the specific means. And then number two, the actual message that we deliver. So I think if we can design a really good program to reach out to people and to be able to do these things, as you say, voluntarily, to kind of keep in cadence with the spirit and the way that most of us feel here in Humboldt County, to protect autonomy, to make sure that we can continue to do the things that we enjoy doing. It's almost a paradox, because on the one hand, what we have to do is very simple, but on the other hand, a lot of people don't seem to be doing it. So if we can change that and align what people are doing with what's in our best interest as a county, then I think that would be fantastic. Really like to work on that together.
I think that those are some great ideas, and I think that we have an opportunity here by reaching out to the people and talking to them about trying to help HGH out. We have an opportunity for those people that don't like HGH that we continue to hear from, that it's not just HGH, it's all of the hospitals in the Intermountain area are struggling at this point. Even, I think, probably all of the hospitals nationwide are struggling. And we have an opportunity to let those people know that even if you don't agree with some of the ideas that we proposed, that you're helping to keep the businesses open. And we all use some of the businesses or all of the businesses in our community. Do we have any other questions to that nature on this item?
Mr. Sheriff Allen, just real quick, I do want to just extend my thanks to the county manager, Dave Mendiola. That was very well presented, and will also help ensure the safety and security of our county if we do move forward that way.
Sheriff, while I've got you on, I have a question that came in from Commissioner-elect Hill. He's not on a mic right now, but he's listening. He wants to know, why do you send the COVID test at the jail to McDermott? Are they doing something we're not? Would you please explain that?
Okay, so the nurse that we hired was a nurse for Indian Health Services. She entered into an agreement with the doctor up in McDermott that we were able to utilize that path for these rapid tests. And so they extended that to us for our employees down here and the inmates. So that's exactly what's going on. The doctor it acknowledged that it was an important way to get things tested, and it primarily started with the inmates. And then once we found out a couple of our employees came down with COVID, they extended that offer to us to be able to get the rapid test. We were able to get those done within just a matter of hours.
All right, thank you, Sheriff. Any other questions?
This is Patricia Tyndall from the Pleasant Senior Center. I have one question and then a comment. And my question, I guess, is for Nicole or maybe Alicia. And that is when people get their, they get a letter after we do the wastewater testing, which I think is brilliant that we're doing the testing. So I'm really happy we're going to continue doing that. But I have clients that seem to be confused about what their actions should be because they've gotten this letter. Some of them have called, and I actually had somebody who came in and said, I've got this letter. Does this mean I shouldn't be drinking my water at home or whatever? They might have been in an area. And from what I understand, what I should be answering back is that there's a possibility of an increased amount of COVID cases in that neighborhood, and that they should kind of be vigilant about their own personal care and hand washing and that sort of thing. And also to get tested at the first signs or of any symptom that they might have. They shouldn't just automatically assume it's just the flu or something because they're in, or there might be an elevated level. Is that, I mean, is there any other message I should be answering when these clients call with questions about that paperwork?
Dr. Stringham?
Yeah, I can take that question. So, hi, Patricia. The situation is that the wastewater, of course, has absolutely nothing to do with the freshwater, and the freshwater is absolutely safe to drink, and there shouldn't be any problems with that whatsoever. We're just testing. Alicia is heading a program to test the wastewater in order to be able to see what the concentration of the RNA parts is in each milliliter of water. So that's loosely correlated with the amount of cases of COVID in that particular service area. And so assure your clients that the water is quite safe. There aren't any problems with that. And essentially, the hope is that we can get a good handle on the number of cases we'll be having over the next several weeks. Over the next usually about 10 days is about the lag time. And so I would recommend that no matter what a person's status is in terms of wastewater, where they live and what those concentrations are, that we all do the same things. And we're all very cautious, but we're just issuing these letters so that people who live in those areas that are serviced by those particular manholes that are having high concentrations, that those people use extra caution and realize that it is perhaps more likely that they live in an area where there would be maybe more COVID cases per household. So we're just asking them to be extra cautious is what we're hoping to do. And by the way, I'm not sure where else to throw this in. I had heard from Leanne Cushway by text. She's not on the phone call any longer, but the Binax test, the rapid test, one of the two rapid tests that we have access to, has just been authorized. So we now need to use the card type rapid tests that we have access to. It's approved at this point.
That sounds great. Thank you, Dr. Stringham.
Thank you. So this is still Patricia, and I just wanted to maybe make a comment, and maybe this is for Nicole or Dave. First of all, Dave, you are my hero today. I really appreciate the fact that right out loud in front of everybody, you said, yeah, I kind of rolled my eyes at using masks and, you know, whatever. But now I think it's really important. And that is just, it's brilliant to me. Because so many people, I've just gotten off working with the community harvest and having a lot of clients come in and yell at us about wearing masks and they don't have to. And it seems to me that a lot of people are very angry. I think maybe they're dealing with a little cognitive dissonance because they were told early on that it's just the flu.
a little kind of the same things Mike Bell was saying, and I'm hoping that somebody who's better at public speaking and information, perhaps Nicole, can put out the message. It's okay that, there was a lot of conflicting information about COVID. We've been doing this for 8 months. Different people are saying different things, whether it exists or it doesn't, or it's bad or it's not. It's okay to have listened to that information and decided, yeah, I don't really need to wear a mask. It doesn't seem to be that bad or whatever. And now know, hey, maybe I need to change my behavior. We have better information now. And this is pretty serious, and I am not giving people a box of food because I like them or I'm a nice person, because they need it. But I would like people to be able to kind of get over that idea that this isn't serious, and they have the right not to wear a mask, or they can get right up in your face and yell at you. That they need to stand back a little bit and, try to take care of our community, if anything else. And I don't know how to put out that kind of information to the public, that this is really, we're overrunning our hospital. There's people in the community, you can care about them or not, but, try to do your part and put on your mask. And I really appreciate, Dave, that you just said, hey, I kind of rolled my eyes at the whole idea, but I now know it's really serious and we need to put out a message. And I don't know how to reach those angry people who are possibly angry because they were taken in by some other information. But to get that information out to them. So thank you, Dave, for, just putting it out there and saying, let's get out this serious message. And thank you to Nicole or whoever out there is going to get that information to people. Knowing that the people that, you try to reach the best are those angry people who maybe just feel tricked or something.
Thank you, Patricia. Do we have any other comments or questions? I want to thank Alicia for your report today. I really like watching the graphs and the charts that you've provided us. It's amazing how correctly they follow. Our case count seems to follow it almost identical in a 10-day, 2-week period afterward. So I think now, if I'm right, County Manager, we go to public comment, or no, we need to set a date for next meeting. And my question on that date for the next meeting is, with the uptick that we are having right now, do we want to go 2 weeks, or do we want to go a week?
Mr. Chair, Dave Mendiola, County Manager. Yeah, I think it probably would be prudent to go weekly. To your point a few moments ago, if the wastewater is any indication, maybe we'll have a downtick. But I think there's so many things going on that I think it makes sense that we go December 2nd being the next one, if that would work for folks. And then I have one other idea on an additional item. And actually, we have somebody on the line that we may want to make a comment, maybe during public comment, which would be related to the new line item or the new agenda item I want to add. So,
would it be December 2nd, a Wednesday, or do we want to go back to our normal Thursday?
Oh, that's true. Correct. Yeah, Thursday is usually.
I would suggest we go back to 9 o'clock on Thursday, December 3rd for our next meeting. Does that work for everyone?
It works for me.
Yeah, that works.
It sure does.
Yes, it does.
Okay.
Mr. Chairman, I had a quick question before we move on to public comment. I'm looking at my agenda, and that last item says approval of a high-risk mitigation plan for discussion, possible action. And do we need to take an action on that, or is that informational only?
Well, we probably should.
Yes, sir. Good point. Thanks, Commissioner.
So I will need a motion on that.
Mr. Chairman, as Commissioner French, I would move that we approve the high-risk mitigation plan as presented.
Okay, we have a motion on the floor. Questions on the motion from anyone? Hearing none. All in favor signify by aye.
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 Aye. The motion passes. Are there any nays? No. The motion passes unanimously. Do we have any other questions before we go to public comment? I see somebody raising their hand. Well, Wendy. You're muted for some reason.
Wendy Maddox for the record. I just want to make sure, County Manager Mendiola, that high risk mitigation plan, if the public would like a copy of that, could they get a copy of that from your office, the county manager's office?
Yes, ma'am.
Thank you.
Okay. Any other questions?
Mr. Chair, Sheriff Allen.
Yes.
And I don't know if this would be the right venue to put this on, but I think in the near future, we need to consider vaccination education. Is what we are seeing here at the sheriff's office. As you know, from Captain Wilkins' presentation, law enforcement is in the first tier to be vaccinated. I have volunteered. I will be vaccinated. However, there's a lot of uncertainty with people, and we did go through a PowerPoint presentation that was completed by the State Health Department yesterday. I don't know if that put people at ease, more at ease or not, but I do think that the only way we're going to get on top of this vaccine or this virus is by vaccine and the therapeutics that have been approved. And I do think there's a lot of fear in people and what is this vaccine going to do to me? And I don't know, like I say, if this would be the right venue, but I think this is something that we need to think about on how we can educate the public on the pros and cons of the vaccine.
Thank you, Sheriff. My personal belief is we probably need several venues to address that, and this one would be a good place to start.
Yeah, I would agree with that.
Other questions? We could put that on our agenda for our next meeting.
Mr. Chair, I will do that. Also, I wanted to add, I think another item for the agenda should be a school district update. I know we have Don Hagnes on. I don't know if Dr. Jensen is not, but I didn't look that far down my list, but I think we should add that for future, just to get an idea what's going on in the schools. And then hopefully, Don, since it's not on the agenda, if you could make a comment during public comment, maybe just a quick report on the school, and then we'll have you back next time to give a more detailed report.
Okay, perfect. Do we have any other items you want on the agenda? Okay, we've got our next meeting set for, was it December 3rd at 9 o'clock? And correct. We will move now to public comment. Remember, you'll have to star 6 to unmute yourself. And I do have a comment for us, Don.
Good morning.
Good morning.
Hi, this is Ashley Madden. I just had a quick thing, of course, regarding the challenge and distribution of information. Of course, I'll be continuing to write articles for the paper, but I had one other idea I just wanted to throw out to the health board in trying to get information out to everyone in the community. So as part of the governor's most recent pause mandate, I believe that grocery stores are going to have people at the door counting everybody who enters the facility. We have 5 primary grocery stores in Winnemucca that serve the entire community, and perhaps the health board could partner with those stores to have employees at the door who are counting the patrons distribute information, a flyer, whatever needs to go out to everybody in the community to people as they come in the door. So it's just an idea that I wanted to throw out as another means of overcoming that challenge and trying to get information to every single person in the community.
Thank you, Ashley. It's a good idea. Do you have any other public comment?
This is Dawn Hagnes from Humboldt County School District. Can you hear me?
Yes, I can, Dawn. Thank you very much.
Thank you. I'll just stop in quickly since Dave mentioned my name. From Humboldt County's end, completely unplanned for this meeting, but we did share some data just with our board last night, specifically around staff numbers. And we were at 4 positive cases just in our employees who have all recovered. But in the last 2 weeks, we have dramatically increased. Overall, we've had 58 employees tested. We have 29 positive. Of those positives, currently 4 have recovered. We are finalizing a report for the state today on students. As you all know, as cases go up in the community, that has a direct and significant impact on our schools. We were glad to hear the governor's message about keeping schools open. We do believe we're a safe place. We still believe that the behaviors of our students, our families, and our employees is not necessarily about what's happening inside the schools, it's what's happening outside the schools, but coming into our school that's having a significant impact. While we want our kids in school and we want to educate them in person, it's going to be a challenge soon if we can't keep our employees healthy so that they can be in school. And same thing with our kids. It's becoming more and more challenging to meet the distance education, the homebound and medical side for those on quarantine, for those that are sick, and then also the kids that are in front of them every day. And so we definitely want to partner as a district with whatever efforts are done across the community. We've started a little blast ourselves, and we'll be working on some updates and some information that we can put out on Facebook. But just an idea, and I can't remember, I just sent this to Dr. Stringham this morning. I can't remember what the community forum was last spring, whether it was COVID related or another event. But one of the best things that was done and posted on Facebook at the time, and just be able to talk about what the impact is to individual community or to the community, but to businesses, what impact that's having on the school district, different departments. And then what I heard someone say when talking about our stories, sometimes there are people out there that say it's no big deal if I get it. It's fine because I'm healthy and it's just a flu, it's just a cold. But really hearing some of those personal stories from people who have either lost someone and are willing to come forward or know somebody in the hospital or their own experiences with COVID personally, I think will matter if we really want to tug at heartstrings and beg. Nobody wants our schools closed. We don't either. But what happens when we have more people out than we have in our schools due to COVID? And I just want to thank the FAST team and Dr. Stringham, everybody who has really just been supportive of the work we're doing and trying to keep everybody in school.
Thank you, Don. I appreciate that report, even though you weren't prepared for it. You did a marvelous job. I look forward to having you and Dr. Jensen, both of you or one or the other of you on our meeting each time to give us a report. And please reach out and let us know if there's anything that we can do additionally for the school district.
I will do that for sure. Thank you. I've sat in as a very quiet listener on many of them, so I appreciate the updates.
Okay, thank you. Do we have any other public comment?
I have one. Good morning, everyone. This is Giselle Canales. I'm one of the crisis counselors for Pershing, Humboldt, Lander, and Elko County. And I just wanted to remind everyone that we are still here. We are still here to help employers, employees, people in general suffering from this crisis. And honestly, this crisis has taken off to other problems, which I've seen a lot, and it's isolation, just a lot of angry people, a lot of frustration. And I just wanted to remind everyone that we are still here. I know Wendy had sent Mr. Mendiola a PowerPoint. Me and Leah Farkas, which is my supervisor, are working on a shorter PowerPoint to explain with more detail why we are here and how we can help. And honestly, if you guys know of anyone needing resources, rent-wise, groceries, we're working on other resources. You can always send them my way. Brooke has my information. Wendy has my information. Mr. Mendiola has my information. If you guys know of anyone suffering from anything, go ahead and give them my number or my email. And I know a lot of people are hesitant to talk about any problems. I can help them by doing it over text, over a phone call, over a Zoom meeting. Obviously, because of this crisis, you know, we are taking precautions with a one-on-one, but I just wanted to remind everyone that we are still here helping our communities.
Yes, thank you, Giselda. Can you, could you please give us your phone number and your email right now, and then they can also reach out to Dr. Stringham or to Mr. Mendiola?
Yes, so my direct cell phone number is 775-431-7087. And then my email is gcanales@health.nv.gov.
Can you spell that out for the public?
Yes, it's G, C as in Charlie, A, N as in Nancy, A, L, E as in Edward, S @health.nv.gov.
Thank you very much, Giselda. I appreciate it.
Thank you, guys.
Do we have any other public comment? I'd like to thank everyone today for their input. I thought it was a very good meeting. Next meeting again is at December 3rd at 9 o'clock. So at this time, I will adjourn this meeting at 11:12 a.m. Thank you, everyone. Have a happy Thanksgiving.
Thank you.
Thank you. You too, Ken.